Imagine a headache, a really relentless one that just vanishes, almost like magic, when you lie down.
Or think about a type of cognitive decline, something that looks really serious but might actually be curable.
Exactly. Today we're doing a deep dive into spontaneous intracranial hypotension. You might hear it called SIH.
Hmm.
It's this condition, often missed actually, but very treatable. It all starts when cerebrospinal fluid, the CSF, starts leaking out where it shouldn't.
And what's really, fascinating or maybe confusing at first is the name itself, hypotension.
Right, low pressure.
Yeah, but while low pressure can happen, that's not really the core problem. The issue is more about reduced CSF volume.
Okay, so less fluid overall.
Precisely. Think of your brain floating, cushioned by this fluid. If the volume drops, the brain doesn't float as well. It sort of sags or sinks down.
Ah, I see. And that sagging, that's what causes the pain.
That's the idea. It pulls on structures that are sensitive to pain, and that sagging is worse when you're upright because of gravity. That's why lying down brings relief.
So it's less about a pressure number and more about, well, the brain losing its buoyancy, its physical support. That makes a lot more sense for that specific headache pattern.
Exactly. It's a really key distinction. Now, this condition, SIH, it's relatively rare. We think the incidence is somewhere around maybe 3 to 5 people per 100,000 each year.
Okay, still that adds up. And you mentioned it's more common in women.
Yes, studies show it does affect females more often.
And the symptoms. They sound like they can be all over the place, which must make it a real puzzle for patients and doctors. That orthostatic headache, worse up, better flat, is classic, you said.
It's the most common hallmark symptom, yes. But the tricky thing is that pattern can actually change over time.
Oh, how so?
Well, it might become less obvious, or, some patients, maybe surprisingly, don't report significant headaches at all.
Wow, okay, so if it's not always the headache, what else should you be aware of? What other kinds of symptoms pop up?
Oh, quite a range. Neck pain or stiffness is very common. Dizziness, visual changes like seeing double, sometimes even changes in hearing like ringing, muffled sounds, or feeling off balance.
Hmm, vestibulo-auditory stuff.
Exactly. And then there's the cognitive side. Many patients talk about significant brain fog, difficulty concentrating, that sort of thing. It's incredibly varied.
That huge variation must make diagnosis incredibly difficult, especially if, as you hinted, the standard tests aren't always clear-cut. Like, what about imaging? You mentioned MRI earlier.
Yeah, diagnosis is definitely challenging. A brain MRI can show some telltale signs, things like dural enhancement, where the brain's outer lining looks brighter on the scan. Or you
Mm.
might see physical evidence of the brain sagging downwards. But here's the catch.
Uh,
The MRI can look completely normal in, well, maybe up to 20% of people who actually have SIH.
20%, that's quite a lot. So you could have this leak, these symptoms, and a normal MRI. That sounds incredibly frustrating.
It is. It really is. That's why clinical suspicion is so important. And it also highlights why finding the source of the leak is crucial.
Right. And you mentioned something about CSF venous fistulas. What are those exactly? Sounds like a breakthrough.
It really was a major step forward. These were identified around 2014. A CSF venous fistula is basically a tiny abnormal tunnel directly between the space holding the CSF and a nearby vein.
So the fluid leaks straight into the bloodstream.
Exactly. It doesn't pool around the spine like in some other types of leaks. And we now think these fistulas might account for maybe 50% or even more of SIH cases, especially the ones where we don't see that obvious fluid collection on spinal imaging.
Wow, half the cases. So finding these requires different techniques, I assume.
Yes, specialized imaging is often needed to pinpoint them. Their discovery really changed how we approach diagnosing and treating these patients.
I can imagine. It explains why just looking for the classic signs wasn't catching everyone. And dealing with all this, the symptoms, the diagnostic journey must take a massive toll mentally.
Oh, absolutely. The chronic pain is debilitating enough, but add the uncertainty, maybe feeling dismissed or not believed before diagnosis, it can significantly impact mental health. Severe depression isn't uncommon. It's a really difficult experience.
Yeah, I can only imagine.
And that actually brings us to one of the most, well, traumatic potential complications of long-standing SIH.
Okay, what's that?
There's a rare but really striking syndrome, sometimes called brain sagging dementia.
Dementia from a CSF leak.
Yes. Patients can develop quite severe cognitive and behavioral problems, sometimes mimicking conditions like frontotemporal dementia. They might have personality changes, impaired judgment, apathy.
That sounds terrifying.
It is, but here's the crucial part, the really hopeful part. These dementia-like symptoms are often reversible once the underlying CSF leak is treated.
Wait, really? A reversible dementia?
Yeah.
That's incredible. You fix the leak and the cognitive function can return.
In many cases, yes, significant improvement is possible. It underscores just how much the brain's physical environment affects its function.
That's truly astonishing. So how do you fix these leaks? What are the treatments?
Well, the good news is that SIH is generally very treatable once it's identified. Often the first step is something called an epidural blood patch.
Okay, what does that involve?
We take some of the patient's own blood and inject it into the epidural space in the spine near where the leak is suspected. The idea is that the blood clots and essentially patches the hole.
Does that usually work?
It's often effective, especially for certain types of leaks. But if it doesn't work, or if we can pinpoint a specific leak site, like a fistula,
Then surgery might be needed.
yes, targeted surgical repair can be highly successful for closing specific leaks or fistulas that don't respond to blood patching.
So there are effective options. That's really positive news. You just highlight how vital early recognition is, doesn't it? Catching these varied symptoms, knowing about the imaging limitations.
Absolutely imperative for getting the best outcomes. It really makes you think about how symptoms we see might have underlying mechanical causes we haven't fully appreciated yet.
It's a powerful reminder that sometimes really profound health issues can stem from these subtle, almost hidden physical problems.
And it definitely raises a broader question, how many other conditions out there have symptoms that seem fixed, irreversible, but might actually be treatable if we understood the root cause better? SIH is a case study in diagnostic challenges, but also in medical progress.
A really important point. For anyone listening who wants to learn more, resources like the Spinal CSF Leak Foundation are a great place to start.
Definitely recommend them.
This has been the deep dive. We really hope digging into SIH helps you feel, well, even more informed